So in Salem, plans are moving forward in the legislature to tackle the state's healthcare staffing crisis. Jamie Seymour spoke with those directly involved with one bill that is making its way through. What did you find out, Jamie?
The House bill would require hospitals to make staffing plans to improve frontline working conditions. Those rallying for change say it's just a first step. Hospitals and healthcare unions across the state are teaming up with state lawmakers as Oregon faces a growing healthcare worker shortage, an issue only exacerbated by the pandemic and burnout as more leave the industry.
Even if hospitals are able to recruit and the education system is able to create a lot of nurses, if you aren't retaining them, we're never going to get ahead of the problem and fix the problem.
Now, House Bill 2697, introduced this session, would require hospitals to make staffing plans to reduce patient assignments and high workload, while also improving conditions that could then entice more workers to come to the state. Citing studies through leading medical programs and the National Institutes of Health, State Rep Travis Nelson, one of the co-chief sponsors of the bill, says this staffing crisis goes beyond the employees.
We know for sure that short staffing leads to death and unwanted injury in hospitals. And I don't think that should be overlooked.
This week, the Oregon Association of Hospitals and Health Systems came together with many of the healthcare unions, like the Oregon Nurses Association, to make changes to the bill that work for different types of hospital settings across the state, like adjusting the number of patients assigned to each nurse.
We believe that by having better work environments, they're going to have better opportunity to recruit workers, but also there needed to be some flexibility for some of the hospitals that are in outlying areas in Oregon and some of the departments.
As other measures also make their way through the session, tackling hospital capacity and healthcare costs, lawmakers and healthcare advocates tell KOIN 6 the goal is to not only help current frontline workers and hospitals, but also bring new nurses to the state.
You know, nurses continue to work, they get burnt out, which leads to more short staffing. And so we're hoping to interrupt that cycle. We're also hoping to attract nurses to Oregon as well.
The changes to the bill will head to the House Committee on Behavioral Health and Healthcare on Monday. Reporting live in downtown Portland, Jamie Seymour, KOIN 6 News.